Hi, I'm Dr. Arti Thangudu. I'm an endocrinologist. That means I'm a physician who specializes in diabetes, thyroid, hormones, and other metabolic conditions. Today, I'm here to talk about antibodies in Hashimoto's thyroiditis. If you haven't seen them yet, please check out my previous videos on Hashimoto's thyroiditis, what causes it, symptoms, labs, and medications. I also have a video on common diet and supplement questions on Hashimoto's. So, antibodies. The most common antibody seen in Hashimoto's thyroiditis is thyroid peroxidase antibody, or TPO. TPO antibodies are seen in about 90% of patients with Hashimoto's thyroiditis. A less common antibody seen in Hashimoto's thyroiditis is thyroglobulin antibody, or TG antibody. That's seen in about 50% of people with Hashimoto's. About 5% of patients with Hashimoto's have no antibodies. Interestingly, antibody levels do not correlate with disease activity. I personally have seen patients who have detected antibodies in their blood of 30,000 with no symptoms. And on the flip side, I've seen patients with Hashimoto's thyroiditis with symptoms and elevated TSH with low levels of antibodies of 9. Further, lowering antibodies has not demonstrated decrease in disease progression. Because of this, we typically recommend checking antibodies once, and if they're positive, you will likely have them forever. But the level of those antibodies does not correlate with your disease progress, so there's really limited reason to continue to repeat these antibodies. Since antibody levels don't correlate with disease activity and progression, there's no need to try to focus therapies on reducing Hashimoto's antibodies. Also, just because you have antibodies does not mean that you should have symptoms of hypothyroidism. You have to see a TSH elevation to be diagnosed with hypothyroidism. Since Hashimoto's thyroiditis does run in families, people with family members with Hashimoto's often have thyroid antibodies checked early in life, but they don't need to have them repeated if they're negative or positive. So, recap. Hashimoto's thyroiditis usually has antibodies, but not always, and antibody levels don't need to be routinely monitored after they've already been determined. I hope this was helpful and cleared up any confusion over Hashimoto's antibodies that you may have. Please subscribe and please share with anyone who you think might benefit from this information. Thanks so much for being here and see you next time.